My name is Susan Chakmakian, and I'm a marriage and family therapist in Glendale, California. My orientation is basically psychodynamic therapy. I do incorporate an eclectic approach, which means that based on the client, we will work with them the way that works best. I am a clinical director at Teen Line, a teen-to-teen hotline, and so I have a lot of experience working with adolescents and the life transitions that they're going through. I do work with patients with anxiety and depression, and also with infertility issues. That's a real specialty of mine. Sometimes people are stuck in an identity that they think suits them. It could be the identity of being an addict. It could be the identity of being somebody who's not very social. It could be the identity of somebody that doesn't feel good about their body in some way. And they've bought into that idea. And some of the work that I do in this room is helping somebody realize that that might only be a small portion of your personality, and that that thing doesn't have to override the rest of your personality. That doesn't own you. I think that the relationship with the patient is the most important part of therapy. If the patient can trust you and feel comfortable with you, then they're going to act out things with you that they would act out in their world. And that is so essential to the therapy moving forward, because in acting out things with you, you're going to be that objective person that you can notice something and say to them, hey, did you notice you did the same thing with me that you might have done with somebody else? And this is where insight comes in. And you go, oh, I'm enacting this, I'm behaving in this way, and I have the control over changing that. I can see why that didn't work for me. My background is actually music and theater. And when you're involved in theater, you're always acting like somebody else, and you're putting on different kinds of feelings and emotions. And you get to know that a lot about your emotions. And during that time, I started to investigate my own behaviors and thought about, well, what is the psychology behind somebody doing this or doing that? And that led me to thinking more about my own life and my own processes, my own behaviors, and wanting to know more about how I do things and why other people do things that they do, and how I can have more insight and how I can have more control over my life.